First of all, please understand that we provide only English verbal guidance along with Korean screens without preparing English screens.
Guide to Hospital Life at Korea University, Onsan Hospital. 1. Easy to understand guidance on hospital life. 1. Opportunity to meet a doctor and information on rounds. The professor and attending physician in charge of treatment can be identified on the bed name tag. Guidance on rounds. Rounds can be checked through the rounds notification text and the ward rounds bulletin board. Write down all questions you have and ask them during rounds. The round trip time may vary depending on circumstances such as treatment and surgery schedules. 2. Participation in the treatment process. For ways to participate in faster recovery and patient safety. 1. Bring all medications you are taking, prescriptions, and medicine bags. 2. Talk about allergies, major symptoms and diseases, history of surgery, and possibility of pregnancy. 3. Ask questions about treatment plans, side effects, precautions. 4. Say your name and date of birth or registration number, and check prescribed medications or surgical site markings. 3. Pain management. Pain can be sufficiently controlled. Don't hold back and speak up. Look at the picture below and rate your pain on a scale of 0 to 10. A score of 0 represents no pain at all. A score of 2 represents slight pain. A score of 4 represents pain requiring analgesics. And a score of 10 represents unimaginably severe pain. The types of pain include chronic pain, postoperative pain, and cancer pain. If you suffer from chronic pain, it is necessary to consult with a medical professional. If you are concerned about pain after surgery, you can control it with a prescribed pain reliever or a self-pain control device. Those who have been diagnosed with cancer and have started experiencing pain should recognize that pain control is a part of cancer treatment. The use of a pain reliever does not interfere with recovery or treatment. 4. Grievance handling information for compliments, suggestions, complaints. If you have any inconveniences or suggestions during hospitalization, please feel free to let us know. You can speak to the customer service center on the B1 floor of the main building, through the voice box, by phone, or through the internet. We will actively reflect what you have said in our medical services. 5. Patient identification. Patient identification is confirmed by a name and a registration number. Patient identification is checked before registration for medical treatment, before the administration of medicines or blood products, before transferring and testing, and before medical treatment. 6. Fall prevention. Raise the bed railing upwards. Do not get out of the bed or climb over the railing. If you have difficulty moving, ask your guardian or nurse for help. Keep your belongings within easy reach. Do not force yourself to pick up fallen objects. Go to the bathroom before going to bed. Be careful of slips in the shower and toilet. When you feel dizzy, do not get up suddenly. Be sure to fasten the wheels of the wheelchair and maintain a correct posture while moving. Be careful not to get on the drip holder or get caught on the threshold. Since hospitals are unfamiliar places, falls can happen to any patients. Please pay attention to patient safety. 7. Guidance on stopping of taking medications brought by the patient. Are you taking any medication before hospitalization? Do not take any medication without permission, and be sure to inform the medical staff of the medication that you will take. If you take it without permission, unexpected side effects may occur as you take several medications at the same time during the course of treatment. Submit your medication and prescription to the nurse in charge. The doctor in charge will decide whether you will take it while hospitalized. In order to provide a safe treatment environment in association with the effects of a medication on a treatment process, taking a brought medication is prohibited in principle. If you need to continue to take a medication, we will prescribe a new one for you.
Helpful information on hospitalization. 1. Preparation of items for hospitalization. Please prepare personal items necessary for hospitalization. For example, guardian bedding, toiletries, cups, toilet paper, slippers. The items that are prohibited from being brought are as follows. Coffee pots, electric blankets, matches, and lighters are prohibited for fire prevention, and sharp tools such as knives are prohibited for patient safety. In addition, flowers, pollen, and pets are prohibited. 2. Protection of patient privacy. We do not inform anyone other than the patient himself or herself of the patient's hospital room, disease name, and details related to the patient's treatment. If you do not want to disclose your privacy while you are hospitalized, you can request it from the hospital administration team or the nurse's office. We will be careful to ensure that the patient does not feel shame during the examination or treatment process. 3. Information on hospital room life. When using a mobile phone, please use a low volume for calls, use earphones for watching videos, and use the mobile phone in vibration mode. Please observe hand hygiene and cough etiquette to prevent infection. Access to the ward is allowed only for the patient and one primary guardian. Only those with a patient identification band are allowed to enter the ward. In the event of an infectious disease epidemic, visits to the hospital are completely prohibited. Those who are prohibited from accessing the ward include a person who can spread an infectious disease, a person who requires precautions and/or protection, and group visitors. Meal times and how to request changes. Please refer to the pictures for breakfast, lunch and dinner serving times, and change possible times. If you wish to change your meal, please inform the nurse's office of the change during the period when the change is possible. Parental meals can be requested. After having meal, please place the food tray in the food cart at the entrance of the ward or in the arrangement room. How to use the bed. Use the remote control and the control buttons on the front of the bed. When raising or lowering the bed railing, please press and hold the button next to the railing in order to raise or lower it. For a request for a caregiver, a guide is provided in the nurse's office. When you leave the hospital room, please remove leftover food from the refrigerator in the ward. Please put alcohol swabs and gauze in the medical waste container. Use the diaper disposal container for diapers. 4. How to call the medical staff in case of emergency. Press the call bell on the bed. There are also call bells inside the restroom, the shared bathroom, and the lounge. 5. Ward facility information. There is a shared bathroom for each ward room. The lounge is a space used by many people, so please refrain from talking loudly or sleeping. There is a hot-cold water purifier and a microwave in the arrangement room. Do not heat food in the microwave for more than 5 minutes. Furthermore, refrain from heating foods such as squid or cheongukjeon that smell strong to others. Dispose of the patient's feces in the waste disposal machine. In the waste disposal room, put the patient clothes and blankets used in the laundry basket, and dispose of gauze and items with bodily fluids in the medical waste box. 6. Hospital amenities. On the B1 floor of the main building, there are food court, a bakery, a convenience store, lockers, and a medical equipment store. On the first floor of the main building, there are a coffee shop, bank ATMs, parking information, and video registers. There are a lounge and a drink vending machine on each floor. There is a religious room on the B1 floor of the annex building. 7. Parking information. Please refer to the table for parking information. 8. How to deal with a fire. When you discover a fire, you must announce "fire" loudly to those around you. Follow the guidance of the staff and evacuate to the first floor through the emergency stairs. Elevators are prohibited from boarding until permission is given. Cover your nose and mouth with a wet towel and evacuate in a low position along the guidance lights. 9. Other precautions. To prevent fire, do not use an electric heater. and use a microwave oven properly. All facilities in the hospital are non-smoking areas, and fines are imposed for violations. Smoking areas are located behind the funeral hall, outside the building, and in the smoking booth next to the south entrance to the subway. Please take care of your valuables and be careful about valuables or cash that may be stolen. We will not be responsible for theft. If you want to go out, ask your nurse and go through the hospital procedures. Unauthorized going out to use outside convenience facilities around the hospital without permission is strictly prohibited. Meanwhile, when an infectious disease is prevalent, going out is completely prohibited.
Guidance on discharge. 1. Information on discharge procedures. Discharge is usually decided one day in advance, after consultation with the professor and the attending physician. 2. Request for issuance of certification documents. Please contact the nurse's office for necessary documents in advance. It is difficult to issue certification documents on the day of discharge, and you can request the issuance of certification documents upon outpatient treatment later. We wish you have comfortable inpatient stay.
Thank you.